hopefully you're able to share screens. You can go ahead and get us started. And if you have any tech issues, just let me know.
Awesome. Thank you, Amy. I'm just going to make sure I can get the share screen going. And then since I will be sharing my full screen here, hopefully, it will probably be taking up most of my screen. So Allie might be the person to watch the chat and see if there's any questions coming through in the chat, which you're welcome to do during that time, and we can take questions at the end too. So we might hold some of them till the end if that makes sense. So, apologies, I'm just trying to get this going here. Slideshow. Oh, it looks like I still can see the chat too, so that works. Okay. Allie, do you want to unmute just so I can make sure that I can hear you too?
Yes. Can you hear me?
Yes, awesome. Perfect. So Allie and I are here from the Disability Resource Center. We are both access consultants. I use she, her pronouns, and I'm a senior access consultant. So essentially what that means is while I do work with a general caseload of students for part of my caseload, I also work with some of our professional students, pharmacy students, occupational therapy, mortuary science. Allie, you want to
Yeah.
take it away?
My name is Allie Kim. I use she, her pronouns. I'm an access consultant generalist, so students on my caseload come from a variety of programs here on our campus. Okay, so before we get started, we just wanted to recognize access measures. We know everybody has access needs, so if at any time in the presentation you need to sit, stand, stretch, take breaks, that's totally fine. Let us know if we're talking too fast. We will describe visuals and images in our presentation. You should be able to access our slides as we share them ahead of time. Please enable Zoom captions if needed. Raise your hand or use the chat for engagement. And we ask that you say your name before speaking. Um, so what we are going to cover today is, well, we've already covered the welcome and introductions as well as the access measures, and then we will share some general updates regarding DRC leadership and a database transition. And then we will also talk about getting students connected with the DRC, which includes our maroon and gold pathways, and we can answer any questions that you have either during the presentation or at the end.
Okay. So I'm going to just talk about some general information and just really briefly touch on some general updates. We didn't put a ton of it on this slide because it's actually a little bit older information at this point. And we'll be getting into some of it sort of in progress in some of our later slides. But the Disability Resource Center works with students, employees, and guests with disabilities to facilitate access on an individualized case-by-case basis. So overall, we serve about 5,000 undergraduate, graduate professional students, 2,000 employees, and again, guests of the university. Oops, sorry. So I always just like to hit on that point because we just got done with our commencement ceremonies for the year. So guests to the university for things like that, and also guests to the university in the form of incoming new students and their guests that they might bring to activities like orientation. So that is a realm that we operate in. One of the things that we talked about or that was touched on in the agenda is just the leadership transition updates. This is kind of some old information, but we do have a new director in Emily Ellinger now. So that's probably something you've seen in plenty of announcements. And Emily used to be one of our student access managers, so has been in the DRC for a long time, which is really exciting. And so we've had database transitions as well over the past year. We're going to talk a little bit more about some of those pieces when we get to more of like our maroon and gold pathways later on. But that's been going well also. And hopefully the things that you have seen of that, if you teach courses has been as smooth as possible. Um, this is a new infographic. We've updated this from previous years just to share and show sort of the buckets of populations that we work with in the DRC. So the screen shows a number of disability and health condition terms, and they're by size for the size of the population that we work with, kind of relative to one another. So you'll see that multiple disabilities is the largest, followed by mental health and ADHD. Following behind that, we have medical, physical, and chronic health conditions, autism spectrum disorder, learning disabilities, brain injuries, and then some of the smaller text has blind and low vision students, deaf and hard of hearing students, social and communication disabilities, and then temporary disabilities as well. So as students are coming into the institution, it's their first touch points with us. We are able to work with students once they have confirmed their enrollment, which now that we are past May 1st, hopefully almost all of them have done. But once they've done that, they can schedule a consultation appointment with the DRC by reaching out to our front desk. They can email our front desk, visit our website. We'll have multiple links and QR codes throughout the presentation that takes you to that website page. But the DRC, us and all other DRCs across the country and universities don't have a mechanism for identifying students who have accommodations in the K-12 setting. So like a 504 or an IEP, that information doesn't get shared over from K-12 institutions. Students do have to self-identify if they want to use accommodations in the college space. So they would then need to engage in our process, go through the process of reaching out to us. And we do see parent involvement, but we do have to have a release of information for parents to be involved in this process. And we still are very clear that the student is in the driver's seat and has to be the one making decisions about accommodations and communicating, being the primary communicator with us. We do have what we term as information sessions. Some of you might have known it as drop-in before. It's available throughout the school year and the summer for brief conversations and questions and can be utilized by prospective and incoming students. That'll get touched on a little bit more again in some of our future slides too.
This is Allie. So when students first get connected with us, we engage in what we call the interactive process, which includes a confidential initial appointment where we gather a self-report from the student of their impacts and the barriers that they may encounter in an academic environment on campus. Sometimes students have an accommodation history that can be really good for us to know as like a jumping off point. Not all like K through 12 accommodations, for example, can directly apply in a college environment, but sometimes that accommodation history can give us information about other alternatives to support them. We also do collect documentation from students. It's always really helpful if they can have it ahead of time, but if there's any issues, gathering documentation prior to meeting, we try to be as flexible as possible to make sure students have access to our process. Once we've gathered all that information in the appointment, we determine reasonable accommodations, and sometimes we may consult with instructors as needed, depending on the structure of their course, the particular essential course outcomes that the student may be encountering to make sure the student has access. We've also provided this little image with a circle and 3 arrows around it. The arrows signifying faculty, the student, and the DRC kind of represent how the interactive process has us all work together collaboratively, because students inform us about their specific barriers, their resources and strengths. Not all students with the same diagnosis have the same impacts, so it's important for us to connect with them individually. Faculty can inform us about the essential course outcomes and like what the student needs to be getting out of their course, especially based on the particular curriculum. And then as an access consultant, we work with students to determine reasonable accommodations to make sure that the student is on an even playing field with the other students in the course. Um, so yeah, like I said before, we use the interactive process. We try to have like a very individualized process that reflects the particular student that we're working with, their needs. We don't determine accommodations by disability type. Like I said, two students may experience the same diagnosis differently. Um, and some accommodations might not be reasonable if they interfere with essential course requirements. So, like, for example, if group work is an essential part of a course, then potentially we would need to explore accommodations to support group work rather than a student not engaging in group work at all. Um, Also, an accommodation would not be reasonable if they constitute an undue burden for an instructor. This often happens with things like students trying to ask for like retroactive accommodations where maybe they need to make up a large amount of work that is already extremely overdue, for example. Um, or if they interrupt the continuity of care or compromise safety in a clinical setting. So, um, just making sure that in the academic environment, um, all expectations are being met and everybody is safe in their learning environment. So common access barriers that we encounter with students include sensory barriers, for example, with sound, smell, and lighting. This comes up a lot in housing accommodations, particularly. Um, Large groups of people may require students to have smaller spaces to decompress after being around large amounts of people. High demands for executive and motor skills, unknowns and unpredictable circumstances, inconsistent social rules and supports, and attitudinal and social barriers. So, yeah, more examples. Um, so, if a student encounters impacts for note taking and listening to lectures at the same time simultaneously, maybe gathering both audio and visual information, maybe an accommodation that we would request to support them is recording lectures, or students with physical and mobility impacts may need some equipment modifications or classroom support, perhaps a stool in a lab setting so that they don't have to stand the entire time. But this is basically how we determine reasonable accommodations is that we gather the barriers and then try to um, think of accommodations to mitigate those barriers as much as possible.
Sorry about that. I was trying to find the little bar to unmute and it wasn't popping up for me for some reason. It was just moving my slides. This is Abby again. Following along a little bit with what Allie was talking about for connecting with an Access consultant. I want to say it was probably about maybe a little less than 2 years ago now. I'm forgetting time frames around when we implemented these processes, but we've long had our what we now call the gold process, where a student meets with an access consultant, but we also have added the maroon process in recent years. So that might be a term or terms that you've heard come up when looking at DRC websites or talking with access consultants. So there was a question from some of the advisors to do a little bit of a deeper dive on what these processes are and what they mean. So I'm going to do a little bit of that and talk about these in depth. So hopefully, if you're talking to students and either they bring up questions about this or you're directing them to our website, you know maybe a little bit of the basics of how to talk about them. So starting with the gold accommodations process, this is what I think a lot of folks think about when they think of students coming and having a meeting with an access consultant. Um, the two things that are needed from the student's end, they need to complete the student information form in the AIM portal. AIM is our new database accommodation institutional management, I think. I can't remember exactly what it stands for. Um, but we call it AIM and it's in the portal. And students can do that and then schedule an appointment with the DRC staff member using our online calendar that our front desk will send them. And then what can be addressed in that meeting, any accommodations available through the Maroon Path, which I'll talk about in a minute, and more. So essentially, if a student has anything that they're unsure about, maybe they've never used accommodations before, maybe they want to talk about a more complex situation, that's when the gold process is usually going to be the best path for them. So again, more links on this page to get started working with our office, where they can go fill out that information form and then subsequently schedule with our office. The accommodations process we've had more questions come out about is the Maroon accommodations process. And we put this in place back when we were having a lot of long wait times. We would have some students who are very familiar with accommodations. They've used them for a long time. They know exactly what they need. And those consultations one-on-one with an access consultant usually would be pretty short. And so we decided we wanted to try to streamline some of this as much as we could to help with those wait times. But there's only a few accommodations that students can actually put into place through the Maroon Path. So we want students to be clear about the fact that this is a little bit more of a limited process. They still go through an online form, and then they have to fill out more information in a written format about what their impacts and barriers are. So we're still collecting that important self-report from the student. And we're still collecting documentation. We typically, in almost all cases, do not process a Maroon request without having documentation from the student. And then they have to identify from the preset list of what accommodations they're requesting through that self-report. All of these are reviewed by an access consultant. And then we determine, does the student's request make sense? What they're self-reporting through the form and giving us more information about, does it line up with the accommodations that they're requesting? And then if they do, we send those through. If they don't, we will reach out to the student typically and say, hey, I either need more information from you about X, Y, or Z, or it might be good for you to switch over to our gold path because it looks like what you're requesting is something we needed to talk about in a meeting. So this is really the list of what students could request through that process. Certain testing accommodations, so things like time and a quarter, time and a half, semi-private space for testing, certain note-taking accommodations. A common one is being able to record the audio from a lecture for note-taking purposes. Certain classroom accommodations, like being able to take a short break. I'm so sorry about that. Take a short break, access fidgets, access food, beverage. I should also probably add medication to this as well. So like if we have a student who needs to access their insulin in class or something along those lines. Priority registration, which means registering earlier in the registration timeframe. Usually students will be, reporting that they have mobility concerns and need more time getting between classes, something along those lines, so that we can help with some of the scheduling there. And then if a student needs some form of reduced credit load, usually this is in the realm of financial aid. Say they, need to only take 2 or 3 classes per semester because of certain impacts. That might be something that we could potentially go through the Maroon process for. But again, if the access consultant who is reviewing the Maroon form feels that they need more information or need additional support for the requested accommodations, they can transfer the student to the gold path, reach out to them and say, hey, we do need to have a meeting about what it is you're requesting, or we need more information. Sometimes we'll have students who will write in other accommodations that are not on this list into the Maroon form, and that's when we usually will say, all right, we do need to have a conversation about this because that's not one of the accommodations available through the Maroon process. But again, this has really helped in situations where, maybe the only accommodation a student is coming in from K-12 with is a testing accommodation. They can write out their rationale very soundly. They can tell us about why they have that accommodation in place and why they need to continue with it. And we can process that a little bit more smoothly. So that's
Abby,
that. I think I saw something in the chat, so let me just pause here.
yeah, Abby, someone is asking if you could give an example of, a disability that would be associated with the priority registration accommodation.
Yeah, so in addition to the one I mentioned about like mobility impacts around like needing more time to get in between classes, so maybe they need a schedule there where there's more space in between their classes. We also have students where we actually have internal teams that need them to have a priority registration. So for example, setting up ASL interpreting and setting up captioning is very schedule dependent. And so the earlier we can get those students access to their classes, the better because of scheduling. So we'll do that on a number of occasions. And then sometimes we'll have students who will say, due to, say, like fatigue impacts, there's only so much I can do in a day. I need to, essentially try to do my schedule as much as I can. So maybe I only have 2 classes in a day, or I have a large break in between the classes, which I can rest because of the physical impacts that I have. So things like that typically are kind of in the realm of priority registration. So hopefully that answers that question. But yeah, great. Okay. And then again, referring students to the DRC, advisors are very important in communicating to students. You can actually make referrals to us through A+. So we have a number of folks in our office who monitor those requests. So if that's coming over from an advisor, we can reach out to that student and say, hey, it sounds like you may have had a conversation with your advisor about our office. Here's how you get started working with us. The other thing is just to encourage advanced planning. A lot of times, if students have already connected with us prior to talking to you, then they're probably already on top of that. But if they haven't connected with us and they know they need academic accommodations after signing up for their courses is a really good time to get some of those set up. So anytime in the later part of the summer after their orientation is over. We do outreach to incoming students during admissions events and orientation. So we're at the info fairs for orientation, and then admissions does invite us to admissions events even earlier on, so the students can kind of connect with us, learn about us, get more info. And then again, you can share our Get Connected page with students. That's probably the best web page to link them to because it has that getting started information form, all the information about the 2 paths and things like that.
This is Allie. I can also answer the question that's in the chat related to students who would benefit from priority registration, but it wasn't discussed when accommodations were put into place. Students can reach out at any point during the school year to discuss changes to their accommodations. Certainly with some things, there is like a time sensitive component. So like obviously, if it's really late in the semester, like past the priority registration date, it wouldn't necessarily apply for next semester. But they're always able to reach out about any time of day concerns or like fatigue concerns within classes. Sometimes students, like we won't have an accommodation put in place because the student didn't provide us with information as to why they would need that accommodation, or it just didn't come up. So yeah, they're always welcome to reach out to discuss further. So when should students contact the DRC? For incoming students, April through July are hit kind of some of the big ones, which is housing accommodations, orientation accommodations, and then we really encourage students with like more advanced or like more complex access needs to reach out sooner rather than later, especially related to physical access. Like Abby was talking about with scheduling and sign language interpreting, captioning, and document conversion. Basically, accommodations that really must be put in place for the student to be able to engage in the environment like fully. And then in June through August, it's really great if students can reach out for academic accommodations in the summer. I would really encourage them to reach out to us sooner rather than later because as soon as September hits, we get like a huge influx of students, so that can really um, add to our wait times, and that can be really stressful for students. So, especially those that are kind of aware that they will be needing academic accommodations for things like note taking, test taking, navigating flare ups. Um, like having those set up prior to the semester starting can be really helpful so that they can share their accommodation letter the first day of class. So considerations for transfer students, um, similar to the K through 12 accommodations, accommodations from their previous institution do not automatically transfer to the U of M. Um, However, if they have a previous accommodation letter from their community college or other college, that can be really helpful for figuring out what accommodations they need here. Obviously, those accommodations tend to transfer a little bit more smoothly. They've already been applied to a college environment before. Um, and students with later orientation dates may need to explore registering for courses early due to disability-related reasons. Okay, I see a few questions in the chat.
I think maybe we'll hold some of these until the end and then we will go through because we've got just like 3 more slides left. So appreciate
Yeah,
your patience.
Just as a friendly reminder, we will be doing breakout rooms at the very end of the session. So if we're not able to get to all of the questions in the chat today, we can move those to the breakout rooms at the end.
Okay, so a couple of additional connection points. Some of these are reiterations, so I'll go through some of these a little more quickly. If you have questions about a specific student's accommodations, so if you are working with a student and they've shared with you that they already are registered, and you want to reach out because they're bringing this up to you, you can always contact the access consultant who signed their accommodation letter. That is their assigned access consultant. We say the same thing to folks who teach classes, as they're the ones who are typically receiving that in relation to the students' classes. But we always tell students they can share their letter with their academic advisor if they want to, but it's still going to be up to them if they want to do that or not. I touched on this earlier, but students, guests, and instructors can attend our information session drop-in hours with an access consultant. These are just 15-minute consultations with our access consultants. They happen Monday through Friday, 11 a.m. to 12 p.m. and then 2 p.m. to 3 p.m. You can come in person to our office in McNamara Alumni Center in Suite 170, or if you want to be connected over Zoom or phone, you can email our front desk and they can connect you remotely. And then again, students can contact us either at our email or our phone number with questions to get further information. And then, we always say that you never know what students are going to need DRC information. And many, many, many students do not have visible disabilities. So you're never going to truly know who's going to benefit from DRC information. So if you're sharing, broader information about institutional resources with students, it's great to share our resources too, because then they can get that information and do that with that what they will. We also encourage students and instructors to be aware that our accommodations are often best used in tandem with building provider support and skills. So we often are encouraging students to also access resources like the Tutoring and Academic Success Center, some of their classes, even some of their skill building classes, and then some of the groups and individualized support available through Boynton, who is now Boynton Mental Health. We need to combine those on our slide, but they have a group for folks with ADHD and chronic health conditions, students navigating grief. So that's a really, really good resource too, and we're often referring students that way. And yeah, thinking about other reasons why students might need to work with us, even if it's not for specific like note-taking accommodations or test-taking accommodations, as we touched on their overall course schedule, maybe needing to take fewer credits and they have financial aid implicated in that. those are reasons why they could certainly reach out and touch base with us. Okay, I'm just gonna time check Amy in terms of like how much time we have for the questions in the chat.
So we are scheduled to go until 11:10, and then we have a break. So you 5 minutes.
Great. So I'll just start from, let's see. I'm going to start from top down. One of the questions was, does DRC encourage students to let advisors know if they have accommodations? We tell them that they can, and it certainly depends on like when they're connecting us with us. Is it before they work with advisors? Is it after? We tell them that all of the information about accommodations and their registration with our office is in their hands in terms of who they share beyond their instructors who are on kind of that need to know. They need to know what accommodations to apply in their courses. So we tell students it's up to their comfort level because we do have some students who want to tell as few people as possible. We have some students who are like, I don't care who knows anything about me, which is great. But we always tell them that's in your court who you want to share that with. And then, can you share more about how note-taking accommodations work? I've had students who had a note taker as an accommodations, but have struggled to actually have a note taker. Can you share how that is communicated to students and instructors? Can I ask a clarifying question? Are you asking about struggled to have a note taker in the sense that it's been hard to find one
Yeah.
in the class?
Yep, this is Abby. Yep, it's been hard to find one. And so I'm just curious what they're being told versus what they're telling me. I don't know if what they're telling me about the process, how accurate it is. So I'm wondering what you communicate with them.
Yep. Yeah. So we generally say, talk to your instructor. There's usually some resources that they can share about how the instructor can support them in finding a note taker. If the instructor can't find a note taker to them, we always say, come back to your Access consultant and we'll help explore other options. Because it might be that one class, it's not working out to find somebody even after multiple asks. So we usually, we tell students, talk to your Access consultant again. We'll figure something out. We'll consult with the instructor, things like that. So
that's helpful to know. Thank you. Because they've said, well, the instructor asked and no one said yes. So now I don't have a note taker.
Right.
But
and we want to
back to
explore
you.
if there are other tools that we could potentially use in that setting. So yeah.
Awesome. Thank you.
Yeah. And maybe just I'm jumping down to Christopher's question since it's related to note takers. When we say note takers, we mean peer note takers. So usually what that means is that a peer in the class who is taking notes will share with that student, share their notes with that student. We do occasionally have Access assistants who are providing other access to students in the classroom who can help with note taking. But generally speaking, they're helping with other Access considerations as well, such as visual descriptions or things along those lines. And Allie, I don't know if you want to add anything else about that because you've worked with Access assistants quite a bit.
Yeah, this is Allie. I used to work as an access specialist, so part of my job used to be working one-on-one with students in the classroom and taking notes for them. So that's usually like an option that is offered to students where they may physically be unable to take notes, or a lot of the note taking that I've done in the past has been with blind and low vision students, where part of the note taking also requires visual descriptions and potentially descriptions of what's happening on the board during class in real time. So yeah, we'll usually assign kind of like an access specialist or an access assistant to work with students in those circumstances. But then, like Abby said, for kind of more general note taking, maybe the student struggles with gathering both audio and visual information at the same time, we would probably explore a note taker for that student.
And then really quick to Grant's question, no specific answer probably, but is there an anticipated amount of time we can give students for when they might be able to connect directly with the DRC? Schedule can get pretty packed. The summer is actually a really great time. Like right now, they could probably get an appointment with us in the next couple of days if they would like to. I would say the probably busiest time, as Ali mentioned earlier, is probably September when we get that influx of students. Thankfully, with the Maroon and Gold process, I feel like that's cut down a little bit more, but we sometimes do see, a couple of weeks, maybe 2-ish weeks, maybe 3 weeks. Thankfully, I don't think we've really gotten back into the zone that we were in like 3, 4 years ago, where we were looking at like a month or more. That was pretty extreme, and that led to a lot of changes, which thankfully has helped quite a bit. But sometimes during the semester, there can be, a week or two span, and sometimes, depending on what the student is navigating, that can feel like a lot. So yeah, it depends on the time of year, but right now it's pretty short, which is great. And that tends to be true for the summer. So yeah.
All
11
right.
10, we hit right on it.
Right on time. Thank you so much, Abby. Your work is so important. Appreciate you guiding us through it as we plan to work with students throughout the summer. So everybody, we have a 10-minute break planned. You can feel free to turn your cameras off and we will resume at 11:20.